Good afternoon, everybody.
Hi, how are you today, everyone?
So, my name is Andre Gomez. I am with Spring Hills for the last 6 years. Very excited to do our Facebook Live series. And today we have a very probably timely topic to speak to you all. And I have my partner here, Gloria, who will introduce herself. And again, we're excited about the topic today and definitely looking for questions from the audience today.
Wonderful. Hi, I'm Gloria Berwick. I'm the Vice President of Operations for our Management Service Organization. And again, very excited to be here and talk to you about strong support systems.
Absolutely. So, when we consider strong support systems, I always say, Gloria, that is basically what our jobs are. Every disease process and every family member that we encounter, they're really focused on, what are you going to do differently and to enhance the lifestyle of my family member, right? And the first question or the first topic that I tell the family is, tell me the history of your loved one, and what we call the residual memory, the residual lifestyle. So I want to ask you a question and see how you handle it with your interactions. And it's when you have a family member, who had a very active background, perhaps was a nurse, mother of three or four, very fast going family member, and then they come to care in one of our community's facilities, and now we have to really continue to tap into that residual memory, which keeps them active, or at least the hope of it is. So, in your opinion, what are the first things that we look to really maximize from a social perspective in that family member who, again, comes to us with quite an active background, and that family member is making sure that that doesn't stop when they come to us?
Yeah, I think it's first important to know, if that patient or that resident is cognitively functioning, right? Because we want to hear right from the source itself first, but then we also want to hear from everybody involved in that resident or patient's life, because that is the current support system that they have and will continue to have. We're in addition to an extra layer of support in that. So it's important for us, I believe, and this is the philosophy of our team, is to really understand what's important to that patient or resident. What is their greatest concern? What are some of the goals that they have? Because if we start there, then we can create a customized care plan according to what direction they want to go in,
Exactly.
right? So,
So one of the exciting things we do here, and as you know, and it's something that we I think has made us very successful, is the fact that we do a one-on-one, very detailed discovery,
Yeah.
which we called, which is the way that we really tend to meet most of our prospects, and we really customize and tailor the patient resident experience here for them. So one of the areas that we focus on highly is social stimulation. As we know, social isolation is the fifth highest risk factor why residents, patients, unfortunately decline.
Oh, yeah.
So I wanted to ask you, in your opinion, I know one of the areas that I see family members, really maximizing kind of the recommendations is making sure that that person is using, their dining experience when they eat as a social experience. So we all know as we get older, that's, eating is a social experience.
Oh,
And
yeah.
unfortunately, our seniors tend to become isolated, especially if there's cognitive impairment. So in your opinion, in your experience, how do you think seniors best tend to socialize during the dining experience? Because as we know, there are a lot of different medical and social aspects that are relevant to that. But I think the dining experience is really one that we focus on, and I think sometimes family members don't.
Right, and that's a really touchy subject too, because you have some residents that can eat certain foods and some that can't. So then that can cause a layer of depression or anger or resentment. You have some residents that, can't eat at all. And then it becomes just absolutely sad, right? Or that's the best part of their day. There's some patients or residents that wait all day for their dining time, right? So you really have to balance. Everyone is individual, and everyone needs to be treated individual. So again, knowing what those their dietary restrictions are, and then what's meaningful for them in that experience, because you may have to remove them or put them in a different environment for that. So that's a touchy one. It's a very delicate one, especially because you're right, it can cause a lot of other social determinants if not done properly.
Perfect. So as we get into the strong support system, which is the topic of today, and we talk about, I always like to combat the top 5 risk factors of older adult decline. So we look at social isolation, we talked about. We also have to talk about the number 1 risk factor, which is, again, lower extremity strength, right? Weakness, balance issues that leads to what we, know to be extremely deleterious with our residents, which is falls. So tell me a little bit about when you're interfacing with families and having the discussions with patients and residents, what are some of the recommendations that you tell them, especially at Spring Hills, that we will do for their family member to make sure that we combat that very, very high risk factor of lower extremity weakness in a support system, to make sure that they don't obviously continue to decline? What do you think some of the things that you recommend for our residents and clients to have?
Well, so, we're very fortunate here at Spring Hills to have multiple service lines that can accommodate various situations, right? So I think that initial assessment is key. So understanding that, especially with home care and your exercise physiology program, having that initial evaluation of the patient to see where they're at and meeting that patient where they're at. A lot of times you'll have these I will say prescriptions of physical therapy that are not tailored specifically to that patient, right? So it's really important to understand who that individual patient is and create that prescription of exercise physiology or physical therapy accordingly. And that's your area of expertise, so I won't step on that. But, I think that's where we look is reaching out because, again, we have population health management, but it's our job to reach out to the subject matter experts in that case, which would be your team and the various teams we have here at Spring Hills.
That's great. So, again, today we definitely want to combat and discuss, at least briefly, to give the audience an introduction of what we can do on the top 5 risk factors. So far we've addressed actually 3 of them. We've addressed social isolation, we addressed nutritional insufficiencies with the dining, we addressed lower extremity weakness, which leads me to the number 4th risk factor, which is transfer trauma. So transfer trauma is that event that occurs when a senior goes from one institution to another, usually from their home to the hospital, and they come back. It's a very traumatic experience. Unfortunately, someone else is providing medications, someone else is providing them their meals, they don't sleep correct. So there is a transitional risk management period where that resident goes through a high amount of risk. So I want you to kind of, tell the audience, because I think this is something that Spring Hills really specializes well, which is to really mitigate, reduce, and eliminate that transfer trauma. So let's talk about the first 3 days of discharge and population health, and all of our teams are, this is what, we specialize in. So what are some of the things that we do initially in the first 3 days of discharge and beyond, to really encompass the first 30 days to make sure that that readmission doesn't occur and that that person has a seamless transition back home?
Yeah. So I think the hardest part about this transitional process is individuals remember how they were prior to going into an acute or hospital setting, right? So they know before I left for the hospital, I was cooking, I was cleaning, I was, performing certain activities, right? Exactly. They have this event, they go into the hospital, and they, in their minds and their families, unfortunately, that's the biggest key, is really having the family meet the patient where the patient's at and having them understand, because to a daughter or son, it's, well, mom and dad was cooking right before they went to the hospital, right? So it's really getting everybody on the same page of where their loved one is at, or the patient themselves, right? So there's that education and making sure that everyone, it's a multidisciplinary approach. So whether it's the doctors, the physical therapists, the nurses, the dietitians, everyone needs to have involvement with this patient first and foremost. before they leave the hospital setting, and make sure that they understand what's actually going on. But that has to carry on. It can't just end there,
Yep.
right? So that's where our team really comes in, and that's where population health management really has a strong role in transitioning those patients into that next environment. It could be a post-acute skilled setting. It could be a home care setting. Who knows? It could be a long-term acute setting. Whatever that setting may be, we need to make sure that everyone has the same expectations and goals. And they don't have to be crazy goals, but little goals that are easily accomplished, because unfortunately, sometimes we have this mindset that we're getting mom right back to cooking and cleaning the same
Right.
way before she left. So that's where the multidisciplinary team comes up with an individualized care plan.
And I love that you said multidisciplinary, because aging, and as we see our seniors decline, it's what we call a multifactorial geriatric syndrome, meaning that there are
Yeah.
multiple aspects that are causing that decline. And I do believe, again, if we go back to the topic at hand, which is a strong support system, we have to look at making sure that we are identifying the various reasons that may expedite or really precipitate somebody's decline. So I believe in the multidisciplinary approach so much, and the family has to be involved.
They do.
Every caretaker has to be involved. Professional caretakers have to be involved, and then we have to segue into our second highest risk factor for older adult decline, which is medication errors. So when we talk about medication errors, when we talk about polypharmacy, when we talk about a lot of the decline that occurs, unfortunately, due to the mismanagement of those medications, what are some of the things that, from a population health perspective, and in our communities, how do we combat that, to make sure that those again, medication errors do not occur? Because again, it's a strong support system that we're trying to accomplish here, and really focus on that multifactorial approach.
Yeah. So we're fortunate enough here to have a pharmacy program at Spring Hills, which is extremely beneficial to our residents and patients. But even if we did not, and if we were just talking about an average patient, it's so important to have that primary care aspect, to tie all the specialists in together. Unfortunately, when a patient goes into an acute or hospital setting, rather, their medications change, and they are discharged on certain medications. They do not understand them. They come home, and what do they have? They have that big shoebox full of all
Yep.
the pills,
Yep.
of everything they took before. Most of these patients, unfortunately, have polypharmacy issues, which are, multiple medications, right? So they do need a medication reconciliation. So what we do here at Spring Hills is take a proactive approach with our population health management team, with our registered nurses who start the process and go through the medication reconciliation, work with our team of pharmacists, our clinical pharmacists, as well as the physicians. So whether that be their cardiologist, pulmonologist, primary care, we get everybody on the same page and really start addressing the quantity, and then we start looking at, are these the appropriate medications, right? And that's where the clinical pharmacy aspect really has benefited the Spring Hills population.
Beautiful. So let's recap so far. We've had a very active conversation about what constitute a strong support system. We chose to really focus on the top 5 risk factors that we deal with, and the way that we combat those top 5 risk factors. So just to recap, the number 1 risk factor, lower extremity weakness, balance issues that lead to falls. Number 2 being medication errors and the polypharmacy and the deleterious effects, again, that can occur from having a mismanagement of the medications. Number 3, nutritional insufficiencies, and really the focus on dining being a social experience to make sure that we're getting the right food into our residents. Number 4, transfer trauma. And that's chronic comorbidities, those chronic complexities that tend to exacerbate, when they go from one place to another. And number 5 being social isolation. So those are the top 5 risk factors that we have really built a comprehensive battle plan to make sure that we, again, allow our clients, our residents, our patients to optimize their freedom and really be able to age in place effectively.
Yeah.
You were going to say.
Yeah, I think, to another, just an aspect of how we battle it is really getting the patient themselves to engage in their
Absolutely, yeah.
success. I mean, of course, if they're cognitively able to, but it's really important if they're involved in their care plan and they're involved in creating that pathway, we can better hold them accountable, right? Because we do talk about, the word compliance is used a lot, but really it comes down to how well they're engaged. And it's our job to engage them. If healthcare continues to go in and say, okay, Mrs. Jones, this is your diagnosis and you have to do A, B, or C, then you're not really giving that patient much involvement in their own care, right? So we want to involve them in the decisions and give them options. And so I think that's where we really excel at Spring Hills, is having multiple options available to our residents and being able to properly articulate what those are. So I want to add just that patient engagement aspect.
Absolutely. Listen,
we do that very well.
I think the engagement, and I don't like to use the word compliance either.
Yeah.
I like the word adherence. Right?
Yeah.
People adhere to be empowered for their better well-being. So, not to get too nostalgic here, Gloria, but you and I sat a couple years ago at the beginning of COVID, and I remember having conversations about how we were going to really service our clients. At the fact that we faced this pandemic head on, and we didn't know really what was going to happen.
No.
It was a very uncharted territory, and I remember being in our office as you and I kind of just say, hey, how are we going to really
How can we help?
almost reinvent ourselves,
Yeah.
right? And one of the things that goes to mind is, I think the value of people having social stimulation, when they were in their rooms, for a significant amount of their time, but one of the things that I love that your team did, and I know as a whole Spring Hills did, was really maximize that time in the room to make sure that we use telephonics, that we use remote patient monitoring, that we use a lot of virtual services to be able to touch our clients. And I think that when I think about what we did the last 2 years is really the leveraging of technology, really the leveraging of artificial intelligence, and the ability for us to maximize the engagement, which you talked about, even at the in an environment where patient engagement, because of COVID, because of the social distances, because of a lot of the isolation, it wasn't easy. So let's talk about that, because I think that's, we learned so many lessons in the last 2 years about maximizing the virtual patient engagement that I think are going to pay dividends to us in the future as we kind of start a new path as it relates to our bedside and engagement of our clients.
Yeah, well, so during that time, if you recall, we really talked about the patient deconditioning, right?
Correct.
One of our biggest concerns was, they're not leaving their rooms or their houses. They're not going out. They're afraid to go to their doctor's appointments. How do we stay above that? Because when they do finally go out, they're not going to be at their original baseline. So we had to get creative, because when we were getting creative, others were not.
Exactly.
Patients weren't getting routine doctor's appointments. Patients weren't going to having their elective surgeries. But ours were, because not only were we addressing the things that you just discussed, all those wonderful things, we were making sure that they were engaged, they were going, they were getting, if they couldn't get to their doctor's appointments, we were arranging for their doctors to come to their house. We did a lot of house visits. We used a lot of technology, but we kept our patients engaged. We kept them moving so we could get them right back into their normal routine again. And that was super important for our population. So I love the topic, but we didn't stop doing it. So that's the difference, right? It wasn't just, at the time it was, this is what we have to do. We have to be innovative. And now that we've done it, we realized, wow, what an impact have we've had on healthcare, and where can we go from there?
Exactly. And one thing that I think we learn about life can be cruel in the fact that it gives us the test and then it teaches us the lesson, right? So I think we've learned a very important lesson in the last 2 years, and that's really kind of what I want to focus on. Is we are in a new age and a new wave of healthcare continuum where the client, again, we've inherited a much higher acuity client now,
Without
right?
a doubt.
That client who unfortunately either did not seek our services, that client who was isolated, or that client who is just afraid. You know, fear is a debilitating phenomenon, unfortunately. And you know, when you talk about strong support systems, it takes a strong support system to really liberate people from their fears, liberate people from, you know, the trepidations and the skepticism that they have to get back into society and get back into the mainstream. So one thing that I think that we learned is that, you know, when our residents, our clients, our patients take advantage of the entire continuum that we
Yes.
offer at Spring Hills, they tend to thrive.
Absolutely.
You know, not only short term, but in the long term. So let's talk about that. I know, you know, we have a suite of services and a very robust, comprehensive continuum here at Spring Hills. But I think that's what I'm really proud of, the fact that we're prepared to really address and combat the patient of today and the patient which ultimately will be the patient of tomorrow.
Yeah, well, that's our job in healthcare, right? To always be prepared. Most people panicked and said, you know, we don't know what to do. COVID, a pandemic, and we said, okay, this is our job. I think that's the difference. Spring Hills, we sat down that day and we said, what can we do? How do we help? This is what we do. You have to always be prepared to pivot in healthcare.
Right.
Anything can happen tomorrow, right? And that's what we've been able to accomplish here at Spring Hills, is having those suite of services and amenities to be able to accommodate different circumstances, right? So I'm also very proud of that. And what we have is the ability to assess our patients' needs. So maybe one size doesn't fit all and all the different, but we can pick and choose and tailor that and customize that to that specific patient's need. But I think I just want to really just emphasize where my pride truly came from is we didn't panic. We were ready because of what was built here at Spring Hills.
And I remember, again, when we were having the discussions early on during the pandemic, and it's something that in hindsight was prophetic, is that we made a decision early on, which turned out to be a great decision, is that we were going to be remembered for trying.
Yes.
We were going to be remembered for actually taking care of our patients and clients and families rather than be forgotten for not.
That's true.
You know, and I think that's something that, you know, really, you know, as I think about it and as I, you know, sometimes reflect on the last couple of years, that's something that's really been, I'm really proud of. One thing that I know that we're involved in here, and I really wanted to emphasize and take the opportunity when it comes to a strong support system, is a strong support system has to be proactive. A strong support system has to be preventative. I always say preventative medicine yields the best outcomes. Preventative medicine is the best medicine. So telehealth. Telehealth and the ability for our patients, our clients, to proactively access care. One of the things that we learned during the pandemic was the inability of our patients to get the engagement, to get access to physicians. You know, we talked about, you know, healthcare, the genie came out of the bottle. You know, virtual healthcare, when it came to telemedicine, now it's the, you know, the thing to do. So we have a really great opportunity with telehealth, and it's something that has sprouted during the pandemic, and now we're going to really put it to life. So let's talk a little bit about that, how we're approaching clients and residents to take advantage of our telehealth opportunities to make sure that they're being preventative and proactive in their care.
Yeah, so going back to our initial discussion about our concerns about that deconditioning that could happen, we still have a lot of individuals that are fearful of leaving their homes, or they've gotten accustomed to staying in their house, which is definitely an issue. So they don't want to go to the doctors, they don't want to go to the hospitals, and they have also gravitated to the comfort level of having services in their homes. So telehealth has been able to really take that preventative approach, as you have said, but it's not just for primary care. The specialists are doing. Physical therapy can do it. Psychologists can do it. You literally can access any point of care and quickly. Whereas, unfortunately, it's harder to get to. Even if you can go to the doctors, you might wait a month, 2 months just to be seen. Whereas at least you can be seen right away and have a discussion with a provider immediately, and that could prevent hospitalizations. That'll prevent poor outcomes with these patients, and then also just keeping them going if they need their medication medications. How many patients didn't refill their medications during this pandemic because they couldn't get to the doctors to get their appointment to get refilled? So we are actually not only opening access to healthcare more efficiently, but quicker.
Fantastic. So again, the telehealth is one thing that I think we should highlight. I want to highlight from our Continuum, but let's talk again, strong support systems. So I think we've talked about our clients so much, we've talked about our services, but let's talk about who makes that strong support system happen, the magic behind that, which is our associates. And I think our associates right now are really the foundation and the pillar of what makes our strong support system shine when it comes to our families and our clients. And one of the things that I know you do really well is motivate your teams. And even the last 2 years when it was probably the most difficult to motivate our teams, human capital, whether whether they're frontline teams, whether back office, we need a team to really work together and function as one. So let's talk about how you motivated. I know for me in the home care team, I had to really get everybody focused on the goal. And the goal, like I mentioned earlier, is we were going to be that team that was going to be there and engage the patient. We were going to take care of the patient. We knew what COVID was. We knew what COVID wasn't. And we knew that as long as we took the precautions, we were going to maintain that safety. So how did you pivot in your leadership role to make sure that you didn't lose a team and that you maintain the motivation and our associates going? Because obvious't we don't have a strong support system at Spring Hills without our associates. They are the magic behind our results, right?
Yeah, oh, absolutely, 100%. And so our team being a little different, we weren't essential personnel to the facilities or the communities themselves. So we did have to remove our team from the communities and put them remote because at the time that was what was mandated, that if they weren't essential to the building, they had to leave. So that was strange, right? So now I had to move a whole team and put them all in their houses, and that was confusing enough, right? And then expect them to continue to do their job. So there was a lot of morale, a lot of confusion, a lot of fear. So we did get creative, maybe a little a little fun and a little fruity, but we got fun. We had different stand-ups. We had different events during the evenings just to keep the team together. So that was the first step. The first step was keeping the morale up. Then we have, obviously keep the work up, but we had to keep the morale up. And no different than our patients and our families, what are their greatest concerns? What gets them going? What are their goals? Really working with our associates no differently than we do our patients or our residents. We want to make sure we're taking care of everybody and understanding what their needs are and what their fears. Because I'll tell you, especially during the pandemic, everyone's fears were different. So you had to really identify what that was and address it accordingly and make sure that they had the tools that they needed to be successful, whether that's physical tools or mental tools. We had to make sure that everyone had what they needed to be successful during that time. So
fantastic. I'll tell you, my team and our associates is, when I look back in discussing the support system and discussing, how we were able to really get through the past 2 years, it was so difficult for me, to deal with the team at first. But I think one thing that we did really well, and I think Spring Hills does it in general, is we created a vision of that world that did not yet exist.
Yeah.
And we were able to consistently communicate that. And I think it's, what we're discussing right now is a culture,
Yes.
And the culture is basically, I'm very simplistic when it comes to culture is, treat others the way you want to be treated. And I think taking care of our clients the way that they would want to be taken care of, taking care of our clients, our residents, our patients, the way that we would take care of our own family members. And during the pandemic, I think our teams spend more time with us supporting our clients, our patients, than they did with their own family members. So I think it was really, creating a culture that was one that we supported them as much as they supported us. So it really became a team. So I know we're coming on to the end of the Facebook Live, and we've really enjoyed discussing the strong support system. We've enjoyed discussing the top 5 risk factors of older adult decline. And I hope you guys enjoyed the last 2 years where we discussed, the things that we went through and the things and how we got through them. But most importantly, one thing that we're short of is that the best is yet to come, in healthcare and at Spring Hills. You want to say some last words?
I appreciate everyone listening in. We truly do. We look forward to any questions that you have. Please.
And I think we have some questions.
So, we do.
Yeah, we do.
Oh, fabulous.
One was, what can we do first to help people we love?
The first thing we can do to help people we love is we need to listen to them.
Yeah.
I think that's the number one thing as we become, we transition from being, children to caretakers. It's very difficult for us to listen. And I always say when you become an active listener, and an active listener means you want to make sure you sit down and you absorb what's being said to you, the person who's speaking to you becomes an active responder. So they really will help you navigate. I know I'm dealing with it right now with my family members who, are dealing with some, issues. And I will admit sometimes I don't listen enough, either because I'm working or because I have, my attention is distracted. But I think if we just listen to them and effectively communicate with them consistently, I think we'll be able to really meet their needs as much as we can. What do you think?
I couldn't agree more. I mean, and really coming from a background, even prior to Spring Hills, where I did a lot of hospice and palliative care, there were so many times where the loved one knew what they wanted, but the family wasn't listening, and it really caused that patient not to be successful in their own journey. So that's exactly, I couldn't have said it better. Yep.
Yeah. Any other questions?
That was really about it.
Fabulous.
About how we can probably maintain a support system.
So so the way to maintain a support system is anytime your family member, even if you're not living with your family member, or your family member is at a community or facility, just making sure that you are aware of the level of activities, the providers that are involved in the care of your loved one, and really ensuring that you're closing the loop on any types of complaints, any types of constructive feedback that's being given by the loved one or the providers, because it really is a team effort. And I mentioned at the beginning, Gloria, every disease process that we deal with is a familial disease, meaning that it's familial in nature, and we have to take care of a holistic picture, and not just sometimes focus on the client because there are other outside factors. So I think the best way to maintain a support system is just maintain an open mind, and then maintain a really close attention to the needs of everybody involved in that care.
Yeah, no, I couldn't agree more. That advocacy for your loved one it's continuous. It doesn't just stop in the beginning when you're transitioning your loved one. It has to carry through, because that loved one's condition will change every day. Good, bad, or indifferent. The care plan will pivot with that, and you need to be part of that and actively involved, and advocate for your loved one no matter where they're at. It's super important. Ask the right ask questions. Ask questions.
Absolutely. Mm-hmm. Well, thank you so much, and we'll hope to see you again. Have a fantastic day, everybody.
Thank you. Have a great day.